Hey, Matta here with PT Biz, and today we're going to talk about how you can get more new patients from your local workshops. When I started Athletes Potential, I didn't know anything about marketing. I had just gotten out of the Army, and all I really knew was I felt like I could treat patients, and I felt like I could teach classes. I could educate people on different topics. I had to do a lot of that when I was in the Army. And I was currently, at the time, I was doing that for Kelly Starrett's group. At the time, it was called Mobility WOD. So I was teaching in CrossFit gyms, and I was teaching at a lot of military organizations. And a lot of it was teaching people about their body and how to do some basic self-care and understanding sort of movement principles and concepts that were, pretty straightforward, but would help them a lot when it came down to physical exercise and being able to do those things efficiently and safe, right? So what I did was just start teaching component pieces of what I would teach patients, or I would teach at workshops, or I would teach at 1 to 2 day long courses that I was teaching, and I would put them into workshops that would be 40 minutes to an hour. And I would say my conversion rate on this was terrible when I first started, because a number of factors. Number one, I didn't really know how to structure it. I had no pre or post workshop process, and I didn't do a good job of really being assertive about why people should come in to work with me. And there's a lot of things you can go around around improving your workshops and improving your ability to convert. But there's one really big one that I want to talk about, that if you just improve this, you're going to see a meaningful increase in your conversion rates from the people that attend any sort of education event that you have. And this is assuming that you're in a position where you're teaching something and you're in a position of authority of some sort as the educator for this event. And that is your own conviction and confidence about the recommendation to work with you and your team. Now, when I first started teaching workshops, I felt I lacked a lot of confidence when it came to pitching myself. In fact, I wouldn't pitch myself at all. I wouldn't say, hey, you should come and work with me, right? I wouldn't say that at all. I wouldn't say anything like that. In fact, I would just thank people for coming tonight, and I'd let them know, if they have any sort of individual questions, I'll just stick around and I'll answer those. And sometimes I would literally answer questions. I would have a 1 hour workshop, and then I would spend another hour answering questions, just diving into things, giving people homework exercises. Essentially diagnosing people and giving them stuff to do. Go figure, I didn't have a great conversion rate on that, right? But as I started to figure out, okay, Danny, you got to at least try to get patients out of this, because I didn't know any other way to find people. I started to really change the way in which I would position myself, both on the front end and on the back end of a workshop. And this is where you can establish authority, and something that I think will really truly help you if you just adopt this. So the first thing is to establish authority, and do so prior to anything that you're going to do. So for instance, I would introduce myself and thank people for coming to the workshop. I'd say, hey, I'm Danny Matta. I'm a physical therapist, and I own this clinic. I appreciate you coming tonight. Here's what we're going to work on. Now, if anybody in here is struggling with X, Y, and Z, and I would name things that the exercises that we're going to work on would be beneficial to start adding in. And for instance, let's say this is some sort of knee-related workshop. I'd say if anybody's struggling with pain in the front of their knee, or maybe they've been diagnosed with patellofemoral pain syndrome, or they have some variation of a knee diagnosis that's not traumatic, these should be really beneficial for you tonight. Now, the results will be transient. It's not going to last forever. If I show you how to do a positional mobilization or something like that, and you have an increase in range of motion or a decrease in pain, this is a really positive thing that shows us we're on the right track. And that gives us a piece of information. Now, if that's the case for you, and you're looking to truly solve a problem, we can talk about what that looks like at the end and how we may be able to help you, work through that problem long term. But tonight, this is what I want you to be on the lookout for. What things are the clues in movement that make the most sense for you. So I would pre-frame people with the idea of, I have been diagnosed with patellofemoral pain syndrome. I do have anterior knee pain. And he said, I should look for clues. So if I do something where I'm improving hip extension, all of a sudden my knee doesn't hurt as much whenever I squat, that's a clue. I should bring this up with him. So pre-framing things is a very powerful sales psychology tactic that allows people to be more aware of certain things that maybe they would completely dismiss or not really think were as important. So pre-framing what they can expect and if that's a good thing and what that means and what the next step might be is very, very helpful because it helps you position your final sort of close where you're going to essentially pitch what you're doing in a way, and it can be many different variations of this. But for me, I would go back to what I said at the beginning, and I say, listen, if you found things that were beneficial and they helped you at least even have short-term, decreases in pain or increases in range of motion, that's awesome. That means we found some clues that mean that this is not something you have to live with forever. And that's a really good thing. And I would say something to the effect of, we help people just like you get past injuries and back to things that they love for good and live a high performance, pain-free life every single day. If you're tired of trying to figure this out on your own and some of this stuff worked for you, I would love to be able to help you one-on-one in my office and truly make changes that are specific to you and not necessarily a big group. I'd love to hang out afterward and talk to you about what that might look like, if it's a fit for you. And if it's not, and you just had a great time tonight, awesome. Thanks for coming. Tell a friend to come next time. I would finish essentially by pitching myself and wrapping it back up to what I said at the beginning. This is a very, very effective way to include reciprocity, but then also your confidence and conviction in what you do. Because you're not saying, hey, everybody in here should come and see me. That is not a very effective approach. In fact, think about if you were an attendee to a workshop and that person said, hey, everybody in here should come and see me and book a visit. That's not going to do so great. Versus if I'm calling out very specific things that I already talked about at the beginning and I'm reiterating those, I have far more authority with that. I have far more conviction from those people that I probably am the right person that maybe they've been searching for, maybe they've been avoiding shit that we could actually help them with. And now we can actually spend time with them to rebuild whatever it is that we need to help them rebuild so they can get back to the things that they like to do. And that is a very, very honest way of going about it. I think this is what has to align with you. I always felt like I never wanted to make I never want to say something that I was going to be able to do something that I didn't feel like I could do, right? And we know we can't necessarily get everybody better. I mean, that's the reality, right? Like some people do require additional testing or surgery in some cases. And sometimes you just don't know. And your skill set doesn't allow you to make the change that's going on for whatever reason. Everybody has had cases where they just haven't been able to make, the change that they would want and that their patient wants. And it sucks. It's a freaking bummer, right? I hate that. But generally, our success ratio is very high. And our ability to help people, the right people, it's important to let them know that we are the right people for them, because the alternative is that they continue to avoid things that they like. They continue to be in pain, restricted, decreasing their ability to be healthy or maybe move the way that they want, adding stress to their already probably stressful life. And if they're they're just doing these things and they're just avoiding these things, that's not a great place for them to be either. So if you're standing in front of that person and you're too scared to at least position yourself as somebody that can help the right people, that's on you. That is a mindset problem. That is a internal issue that you're going to have to deal with, because there's people in front of you can help and you are letting them slip away because you're scared. And I know what that feels like because I've been there too. And for some of us, it requires the pain of literally having a business that isn't making enough revenue to provide for your lifestyle, your family, the way that you want, that you're finally going to get the courage to actually change something that's probably affecting lots of other things in your life. Your ability to be assertive and confident. There's nothing that you can do that's going to improve that than standing up in front of a group of strangers and having to be confident and assertive about the things that you honestly think that you can do. And once you get past that, your workshop conversions will improve. Your reputation will improve. You will get more people that they don't even work with you, but they attend some sort of event that you have, and they can feel it. Like they can feel it if somebody truly understands what they're talking about and they have high conviction in the fact that they can help somebody get an outcome. We can feel that. Other people can, and maybe they're not appropriate to work with you, but they're impressed and they say, damn, this person was different. I learned some stuff that was a completely different skill set than anybody showed me, that made a meaningful difference in my symptoms, in one night. Or here's another thing. It could literally be your ability to effectively communicate what's going on. I have later today a patient come into my house, and I don't treat patients formally in clinic anymore, but I have a free clinic at my house for friends and family. And I have a family member who had a knee replacement 6 months ago, and they live in a different city, and they moved to the Atlanta area now. And I saw them at a birthday party, and I spent about 30 minutes evaluating his knee. It's not looking good. He's got a lot of work that needs to be done. He's completely sort of not done his rehab on the back end of it. And so at this child's birthday party on a sectional, I sat down with him and I assessed his knee. I had him do some exercises, and I explained to him why he was having pain in certain places like behind his knee now, or why he was feeling unstable, and why he felt like his balance was worse. And this guy did months of physical therapy after the fact. And as we sat there, he said, I did months of PT, and I've never had somebody explain this to me that makes sense in a way that you did, of the things that I need to do. And now to have him re-motivated to do those things is fantastic. I would love to see that he makes a full recovery. I'm sure he would love to have a full recovery so that he can play with his grandkids and do the shit that he really enjoys. And he went from somebody that was just assuming that his life looks like this from now on, being dependent on people struggling with all these things that he used to take for granted, to now all of a sudden, we have an opportunity where we have buy-in, we have trust, and we have somebody who has something that has clicked from an education standpoint, from a communication standpoint, and a trust standpoint that's going to be much more willing to want to put in the effort to actually get this outcome. That could be the thing that you do and you don't even realize it at an event. You might educate somebody on something and clear something up for somebody in a way that they didn't get previously. They didn't understand previously. And if you don't at least follow that up with positioning yourself as somebody that can help them get the outcome that they want, you are leaving money on the table. You're leaving visits on the table. And worst of all, you're leaving somebody in a position where they're going to continue to avoid stuff that they like to do and not live a full life the way that they should. Because our vehicles in life are our bodies, whether we like that or not, whether we want to do whether we want to exercise or not, whether we want to eat right or not, whether we want to sleep enough or not, whether we want to manage our stress or not. This is all we got. That's it. And we can help people with this in this incredibly meaningful way. It's such a significant way. They mean so much to them that they're willing to pay you probably a lot more than you're charging out of pocket if you can get them across the line and they can understand that you can help them. You prove it in some way, even within like intra-session changes within a workshop, and all of a sudden you finish it off by being very confident about who you can and cannot help and who should talk to you. And even if they're not appropriate for you, you're going to leave such a lasting impact on them that they're going to send their friends and family. And that always shocked me. When I would do these local events, I'd be like, hey, how did you hear about us? When we'd have a new patient come in, I would always ask them the same thing. How did you hear about us? Would love to thank somebody. And they would say, oh, Brian sent me your way. I'm like, Brian, I don't know if I've worked with Brian. And they say, no, he went to a workshop that you taught last month on whatever. And I work with him, and he said that, oh, you should go see this guy. I went to this workshop, like he seems awesome, whatever. And I never worked with this person. And that is the compounding effect of what being involved in a local community and educating people can have on you. There's very, very few marketing efforts that you can put in that have a compounding effect of reciprocity like that. There's other variations that can be similar, but man, you nail these things and you're going to have a lot more people coming your way, not just directly from workshops, but indirectly from workshops. And this isn't even without any sort of systems built on the front or back end of this. So the key here is, and the TLDR of all of this is, you got to be comfortable with yourself. You got to be confident with what you can and can't do. And if you can explain these things, especially on the beginning and the end of your workshop, and not shrink and be small and hide and not position yourself as somebody that can help people, you're going to get a lot more out of it. And I'm telling you, I struggled with this so bad. I probably taught a dozen workshops before I even pitched myself. And as soon as I started doing it in an authentic way that felt good to me, because I didn't want to feel like I'm standing up there, just selling to people, just because I felt very uncomfortable with that. And I would hate at any time to this day, even with people that we work with in a completely different scenario with helping with their businesses, I hate telling people I can help them with something and not being able to do it. And that's a good thing if you feel that way. That means that you're an honest person. That means that you care about other people. That means that you're not just full of shit and you like to sell and make money. And that means you have a service-based business, a service-based heart at that. That is a very, very good thing. But that can also lead people to struggle with sales when it comes to these things. So you got to get past that. And as soon as you do, you're going to see your new volume is going to go up. Your clinic is going to have more, new patient volume. You're going to have a better reputation, and you're going to get a huge compounding effect. Because every time you teach a workshop, that's 10 people, let's call it in there, 20 people, 5 people, doesn't matter. That's people that you are leaving a lasting impact on with something that is face-to-face, person-to-person, that's special, that's hard to replicate online, and that will be a buzz about you in a positive way, whether they come to see you or not. I hope this helps you. I hope that you're able to position yourself as the authority that you actually are, and you get past some of the limiting beliefs that you might have about yourself when it comes to actually selling your services. Thanks for listening. See you on the next one.